So today we're going to be talking about doing the foot exam. So the first thing that you need to do, like always, is to go ahead and start from the outside in. So I have already selected my KV and my mass according to my technique chart, which is already open. And I have covered my mouse and my exposure button, so when I'm wearing my gloves, I do not have to worry about contamination. So I've got my KV set, a small focal spot, my mass set according to technique, and we're going to be doing this on the tabletop. I already have my cassette out here ready to go for the next projection. So now when we come into the room, I need to make sure that I have the supplies that I need. So I already have one IR that I have placed out on the table. I have my calipers, I have my shield, my markers already placed, and I have my gloves. I've already angled my tube for the AP foot to a 10-degree cephalic or towards the heel angle, and I have got my SID, and what I did was I raised the table all the way up. I went ahead and got my SID and I aligned my tube with my plate already centered, so when the patient gets on the table, all I have to do is raise it up and I should be ready to go. So the foot exam, we're going to have our patient take the shoe and the sock off of the foot and any artifacts that may be on there. If they have a toe ring, if they have an ankle bracelet, anything of that nature would have to come off. So if you can come on over here, you can go in your left, just have a seat. Your shoe off and step this out of the way, go ahead and swing the legs around. Okay, I'm going to raise this table up. And for her safety, I'm just going to kind of hold on to her shoulder so she knows that somebody is there and bracing her. So all the way up to the top. And as you see, everything's already lined up here. So if you kind of scoot your hips down and lay back. And just lay down there. Okay. And then I just want you to rest your foot nice and flat right here. So we're going to go to the base of the third metatarsal, right about there. So pretty good. To adjust my collimation. Now it's okay that she has the jeans up. I just have to roll them up to make sure that they don't place an artifact on the image. It's nice and flat. Put the shield right here for your protection. Now, if you do have your patient sit up on the table, you need to have your patient look away from the beam. But it's easier, I find, to have the patient lying down. Not only does it reduce the dose to the thyroid, but it also prevents the plate from slipping. So then finally what I'm going to do is I'm going to place a measurement here. Okay, holding hard. Find out if my technique is going to work. Now I want you just to hold very still for me, okay? Don't move. So I'm going to take this back. I'm going to check out my technique chart against the actual measurement of my patient, which they are the same. And I'm going to make my exposure. Hold very still. Beep. You can relax. I'm going to bring in my new plate. With the oblique, we do not need to put an angle on it too. Just rest your foot back down there, just like you had it. Okay, so I'm going to take away the angle. It's now a perpendicular beam. I'm going to work it back up. I have to check my SID again because remember, we had it with an angle before, and that changes once the angle is taken off. So you have to readjust. I'm going to raise up your foot. We're still going to be at the base of the third metatarsal, and we're going to oblique that foot, depending on your clinical site, 30 to 45 degrees. Now for this one, we do not have to measure. We're going to go according to the AP technique. Collimate side to side, top to bottom as needed. Okay, ma'am. Shield is still on there. Hold very still. Now I brought a wipe in so I can wipe this off before I run it. And as I do that, you see how I have my hand the glove covered with the Clorox wipe, so that way I'm not recontaminating by touching it again. All right, same technique as we used before. Hold very still, beep, you can relax, okay? I will get my new plate. And you can also use rad bags and slip your plate into the rad bag if you have them available at your clinical facility. Now for the lateral, we do a medial to lateral, which means that the patient is going to roll up onto their affected side. So if you could roll up onto your hip, face me. Okay, very good. And I'm going to put this underneath your foot again. And put the shield over your lap again. Okay. Now you may want to use a sponge to elevate that knee to make sure that the foot is in a true lateral position. Just going to make sure it's true lateral here. I'm going to orient my tube so the center ray is going with the long axis of her foot. Still entering at the third MT. Okay. My marker is going to go anterior or superior to the part, so closer to the dorsal surface. Okay. Now this I do have to measure to ensure that we're not putting the toes there. So cold and hard again now. Measure at the central ray. Take this with me. All right, hold very still, just like you are. Once again, check that against my chart. Okay. I'm going to clean this one off. Hold still, ma'am. Beep. All right, you can relax. Now I'll show you very quickly how to do a cross table if you need that. So if you could go back onto your back for me, please. All right, and just stretch your leg out so it's extended. Very good. You could bend up this leg, bend that leg up. All right, now if for some reason your patient cannot flex their knee, if they're a trauma situation or something of that nature, you could do a cross table lateral. You're going to have to build the patient's foot up. So I'm just supporting it, resting it down there, okay? It's going to go with the long axis of her foot once again. So my IR is going to be up and down. I'm then going to use a horizontal beam. Still want to have a 40-inch SID. And I'm still going to center in the same location. Base of the third. Making sure that my plate and my IR are as centered as they possibly can. Ensure that it is in as much of a true lateral as possible. I'm still going to place my marker. If the patient can, have them point their toes up towards the ceiling or dorsiflex the foot there. I would still measure using my calipers just to ensure the correct technique. This is if my patient is unable to roll up onto their side, say if they have a fractured hip or something that's not allowing them to roll up. This would be a cross table lateral foot. So that concludes the foot.